Congressman Paul, you have the floor. Do you trust these men to repeal Obamacare?
Thank you. I thought maybe you were prejudiced against doctors and a doctor that practiced medicine in the military or something. No, I want to address the question. The gentleman asked whether he thinks we can repeal Obamacare. Theoretically, we can. The likelihood isn't all that good. We can diminish some of the effect, but I'm more concerned about a bigger picture of what's happening, and that is government involvement in medicine. I had the privilege of practicing medicine in the early 60s before we had any government. And it worked rather well, and there was nobody out in the street suffering with no medical care. But Medicare and Medicaid came in, and it just expanded. But even when we had the chance to cut back on it, when we had a Republican Congress and a Republican president, we gave them prescription drug programs. Senator Santorum supported it. You know, that's expanding the government. So it's endless. And most of them are bankrupt. Prescription drugs, they're not going to be financed. Medicare is not financeable. Medicaid's in trouble. But nobody talks about where the money's going to come from. Now, even in my budget proposal, which is very, very tough because I'm going to cut $1 trillion the first year, but I try to really, even though these programs should have never started, but a lot of people are dependent on, I want to try to protect the people who are dependent on medical care. Now, where does the money come? My suggestion is look at some of the overseas spending that we don't need to be doing. We have troops in Korea since the Korean War, in Japan since World War II, in Germany since World War II. Those are subsidies to these countries. And we keep fighting these wars that don't need to be fought. They're undeclared. They never end. Newt pointed out, you know, World War II was won in less than 4 years. Afghanistan, we're there for 10 years. Nobody says, where's the money come? We could work our way out of here and take care of these people on these medical needs, but we can't do it with the current philosophy of the government taking care of everybody forever on medical care, cradle to grave, and being the policeman of the world. We will get rid of all this government program, unfortunately, because we're going bankrupt and you're going to have runaway inflation, and our checks are going to bounce, and that's going to be a lot worse problem than we're facing tonight.
All right. I'm going to ask all of our candidates to stand by, our audience as well. We have a couple breaks tonight. We're going to take one of them now. One candidate on this